Hello, Texas BTS. My name is Taylor Kurtz. I'm an ortho resident down at the San Marcos location. Came across this really interesting study that's been getting a lot of buzz in the diabetic research community, and just want to make a short 5-10 minute presentation on some of the findings. So the trial is looking at weight management for the remission of type 2 diabetes. It's led by primary care physicians. We'll call this the DIRECT trial, right? It's the Diabetes Remission Clinical Trial. It was led by Dr. Michael Lean. He's a physician. He's the chair of nutrition over in the UK at University of Glasgow, and he convinced the UK government to pay for this study. They're also going through a pretty significant epidemic of diabetes over there, so looking at anything to help out with the financial burden of it. So just some background and how we got here. Right, so really strong correlation between weight gain and diabetes, right? But more specifically, it's this ectopic fat, this intra-organ fat that kind of surrounds the liver as well as the pancreas, and that seems to be more specific to the etiology of diabetes. Right, so we know one intervention is bariatric surgery for patients, and a majority have remission of type 2 diabetes, but it's quite expensive, and not everyone is a candidate. So a gentleman named Dr. Roy Taylor, he's out of Scotland, but he actually conducted a trial a number of years ago based on the twin cycle hypothesis, and we'll actually go over that in the next slide. But Dr. Roy Taylor, his study was pretty brutal. So 600 calories a day for 8 weeks in patients with type 2 diabetes. A really lab-controlled trial, so very prescriptive, a lot of controlled variables. And they found that within the first 7 days, a lot of that intra-organ fat surrounding the liver actually started to normalize pretty quick in that first week. And then over the next 8 weeks, the rest of the organs, including the pancreas, began having normal intra-organ fat levels. And therefore, in this study, at the end of 8 weeks, a majority of patients had a remission of type 2 diabetes and pretty nice function of their pancreas. So this twin cycle hypothesis, this is kind of the etiology of how type 2 diabetes arises. Again, chronic excess calorie intake leads to more intra-organ fat, and that seems to be more closely linked with type 2 diabetes. The blood sugar is kind of what we see downstream. We try to treat those symptoms of blood sugar, but the real problem is more proximal, right? So they're within the organs. So based off Dr. Roy Taylor's, this lab trial of a low-calorie diet, that's nice and everything, but can we actually do that in real life? So can primary care physicians who are practicing, can they make that happen? I don't know, let's find out. So the DIRECT trial is all across the UK, 49 primary care clinics, 2 groups, right? So an evidence-based weight management program, we'll call that really low-calorie program. First, best practice kind of care guidelines. That's more so education, medication, things of that sort. So the common one. Here's your inclusion and exclusion criteria. Kind of some highlights are pretty high BMI for the inclusion. And exclusion, if they're on insulin, their pancreas is pretty much not functioning really at all or well enough for the study. So if you're on insulin, they were not allowed to be included in the study, as well as kind of an out of control A1C, looking at their kidney and heart numbers too. So here's your baseline characteristics. Feel free to check those out. Pretty astounding is the medications, right? So both groups, majority of people on anti-diabetic medications, and then more than half of both groups on hypertension meds and statins because of the risk of cardiovascular events. So can't blame the physicians at all there. So here we go. Here's the procedure for this intervention group, right? So day 1, as they get on this very low-calorie diet, blood sugar goes way down, as does blood pressure goes way down. So they took them off all their anti-diabetic and anti-hypertensive drugs on day 1. First 3 months, a formula diet, right? So 825 to 850, think kind of the boost shake formula diet. Not as brutal as Dr. Taylor's 600 calories a day, but man, that looks pretty miserable. So pretty low diet there for 3 months, low calorie diet there for 3 months. And then after that 3 months, the next 1 to 2 months, 2 to 8 weeks, they are starting to reintroduce some normal foods. And then after that process, they kind of tell the people, there you go, continue current lifestyle, and we'll check back on you at month 12 at the 1-year follow-up. Both groups encourage whatever your usual activity is, don't change that, stick with what you're doing to control that variable as best as possible. And the 2 main goals, losing 15 kilograms and having remission of diabetes, right? So those are 2 main variables. They tracked a few other ones such as sleep, quality of life, etc. And here are your results at the 1 month mark. Feel free to pause right now and take a look at those. Some highlights. Intervention group, 46% of people had complete remission of diabetes. Almost half had complete remission of diabetes. In the control group, only a couple individuals. I believe my N of 148 for the intervention group is actually incorrect. So 20% of the people dropped out of the study, most in the first 3 months, mainly due to social reasons. For instance, going out with people, they couldn't just stick to their diet. So 20% of people dropped out, 80% of people completed. As you see, of those 80% that completed, half complete remission of diabetes. You look at the medications are way down, and compared to the control group, also increase in quality of life, triglycerides, etc. So really, really great results with this fasting group or low calorie group. Here's just a chart. As you go farther into your weight loss, your chances of diabetes remission go way up. Almost an exponential curve, not quite, but quite substantial. So just pretty amazing. Here's your takeaways. Lose 10 kilograms or more, you have a really good shot at having your diabetes go into remission, right? The government was really happy. Wow, this is a lot cheaper than bariatric surgery, and this is now kind of a pragmatic way to go about this. Dr. Lean actually did a post hoc analysis a couple months afterwards, and I'll read you off some of that. You can see one of them here. Just any decrease in risk of cardiovascular events is going to save not only the government but insurance companies, and a lot of people is going to save a lot of money. So Dr. Lean had this to say in his post-hoc analysis. Weight loss is the most important thing that patients can do to reduce their glycated hemoglobin, right? Trying to identify which patients are going to respond best to this, it wasn't exactly, they couldn't really get a cluster for it, but no difference between males and females. Older patients actually perform better than younger patients in this. And then they could also tease out there were certain medications that actually hindered weight loss. So making sure the physician is mindful to look at those medications which might hinder weight loss. Dr. Lean had this to say: if you're going to lose 20 to 25 to 30 pounds, you've got to be committed. And if you do, you'll probably see really nice results. So there you are. Obviously, this isn't in our wheelhouse, but maybe we might see it rolling out. Hopefully as a physician intervention. So really, really interesting, guys. Hope y'all enjoyed this. Feel free to reach out if you have any questions or want to study. Yeah. Cheers, everybody.